Episode of the podcast. Let me know if you guys can hear me. I'm doing this podcast live on YouTube. I've been doing a lot of live Q&As recently. You know, the way that the podcast was traditionally recorded was with questions that people submitted. But, you know, doing this kind of live podcast is an interesting way to do it. I just am answering all your questions right here on the spot without, having ever looked at anything. So that's kind of cool. I sometimes I like to feel good when I do the podcast. I don't like to feel like shit when I record. So today I wasn't exactly feeling fuck my feelings, right? Fuck my feelings. But I wasn't exactly feeling like doing a podcast, but I know I want to do a podcast. I know that's in the cards. Recording a podcast for you guys today was what I was going to fucking do. So, right before I started recording, I just decided I'm going to take my TRT shot. That'll cheer me up. So, about 2 minutes ago, I took 200 milligrams of testosterone cypionate, injected that into my ventral glute. So, I think I noticed like a little bit of a tingling sensation in my lungs too. So, people will wonder, is the cough, they'll talk about trend cough. And it's like, well, you can get the cough from other stuff too. Primobolan cough is a thing. It's pretty normal to get like an itchy feeling in your throat after taking primobolan. Masteron can give the cough, but just testosterone. You can get cough from testosterone. The main thing that gives the cough is when you have some of the hormone and oil flow into your bloodstream like immediately on administering the injection. So, certain compounds are more irritating to you when that happens. And then the chemical excipients, or like the alcohol, the benzyl alcohol, the sterilants, the solute of the injection will get expelled out through your lungs, and so that's why you get that feeling. And certain compounds, certain hormones themselves seem to have different like irritating factors with them. Trenbolone has definitely the one that is the most irritating, and has some kind of thing that is very irritating with your lungs. Some kind of an allergic reaction, which is once that. So basically, if you take a shot and that oil gets into your bloodstream really quickly, it can pass through your heart and your lung oxygen exchange, and those some of those products getting expelled out your alveoli and your lungs, and can give you a cough. It matters like how much of the compound got into your lungs and is being expelled, and then like what was the compound, how irritating is that compound in particular. So that's like as far as like taking roids and then like getting a cough, that's like what happens. It's definitely kind of normal to get a cough. It's not, well, I wouldn't say it's normal, but it's not like unheard of, to get a cough. It doesn't only have to be tren. So usually like a really, really mild version of that would be like an itchy sensation in your lungs. And I just had a little bit of a tingling, itchy sensation in my lungs after taking that 200 milligrams testosterone cypionate shot. And so, one of the interesting things too is that normally when you take a injection of steroids, it sits in the depot. The oil goes into the depot, which is the area of the shot, and it has crystals in it, dissolved crystals, and it deposits those crystals hormone crystals into the muscle tissue. And then that sits there, and the oil is then absorbed very quickly, but the crystals, the hormonal crystals, sit there in the depot, is what it's called, the area where the injection squirted the oil into. And over a period of if it's a long acting ester, over a period of weeks, that those crystals are then absorbed into the bloodstream, and the ester is removed from the crystals. So when gear is introduced to the bloodstream, the ester is removed very quickly by enzymes in the bloodstream. So, like, if a testosterone enanthate injection was given like intravenously, you don't want to ever do oil into a vein on purpose, a large bolus of oil into a vein, that could really hurt you. But, if a person administered testosterone enanthate into a vein, if there was some safe way to do that, it would be pretty much 100% active almost instantaneously. So the ester, the enanthate ester, would be removed like so fast by the enzymes in the blood once it got to the blood. So, if you did notice if you noticed a little bit of a cough or something when you took like a shot of test enanthate, you can know right then and there, oh, I got some testosterone in my blood like instantaneously, because that ester, that means that, the hormone, some of it like got into a vein or something because you sliced a vein on the way in. And, that ester then, once that hormone is in the vein, got removed like almost instantaneously. So, yeah, that's another thing too, as bizarre as this is, like, intrarectal absorption, there's a really high rate of, absorption. Like if a person, let's say somebody's in an apocalyptic situation and they have no access to a syringe to take their testosterone, no needle, and they can't get it into their body and they want it, but they have no needle to administer it. If they put it into their rectum, it would absorb, man. It would absorb, and it would be like really potent. It would be like testosterone suspension, even if it doesn't matter what ester it would be, because it would be being absorbed directly into the bloodstream through the rectum. And once it was in the bloodstream, the ester would be removed, within minutes. And so, whatever type of testosterone was used in that way would have an effect like testosterone suspension, and it would be like very bioavailable and very potent. Man, but I never hear anybody, I've actually never met anyone who's like given it a go, who's given that a try. I've never come across someone, but that is the way it works though. Somebody was asking me about testosterone pellets today, because they said that their doctor he wanted to prescribe him, testosterone replacement therapy and metformin, and he was saying that he wanted to put him on testosterone pellets and that it works really good. So a pellet is like an implant. And usually they put that in your arm. So they put that like in the inside of your arm near where your bicep is. And it's like an implant, and like once it's in there, they like inject it in there with a really large syringe, an implant of this pellet that then slowly releases hormones into your system. And, so the TRT works that way. And so, yeah, I mean, a pellet can give really good testosterone blood levels, really stable levels. It'll last like maybe 6 months, 3 months or something like that. And it will be it will be, releasing daily testosterone into the person, a metered dosage like that. Um, but I don't want that. I don't know why everybody's always got to be screwing around with the way that the testosterone is administered. Intramuscular injections work really good. So, using cream, using some kind of nasal thing, using subcutaneous injections, using an implant. What the fuck is the point of all that shit? I mean, it's just got to be another way to make money, or to have something new so that you stand out and you're doing something new. Because the tried and true method, the intramuscular injections is superior. It works really good and it allows you to control it. It's not too much of a pain in the ass, but it freaking works. It works really good. And the one thing too with the implant, the pellets that they shoot into you, you're going to have this thing in your arm, and you're going to be like, I've got a thing in my arm, and you're going to be able to feel that thing in your arm, and it's going to leave a scar too. So I don't want any pellets, okay? I don't want any pellets. I don't want any implants. I don't want any technology being injected into my body. And I'm going to make damn sure that that's not happening. So that's my take on it. Stop screwing with it. Stop fucking with my testosterone, okay? I am prescribed TRT, and you probably should be too, if you're a steroid user. And you should look for a doctor that is just going to give you the damn injections, dude. Like, if you're finding one and he's like, no, I won't give you the injections, be like, all right, well, fuck you. And go find a different doctor who's a better match for his patient, like you. Better match for you, his patient, because, let him screw around with these alternative methods of applicating testosterone with somebody else. I don't think you want to do that. All right. Dalton asks, what's the best way to get liver enzymes in range after a bad reaction to Superdraw? So, whenever there's things you can do to help your liver, but, you have to remove the offending agent. That's really what fixes the liver enzymes, and they fix pretty fast. So what you'll notice if your liver is messed up, the two things you'll notice is my brain isn't working right, I'm fatigued, I'm tired for no reason, and my eyes look weird. Your eyes might be watering or they might be bloodshot. And you'll have that, you'll have like a foggy, fuzzy head. You won't be able to like think right. And even your vision might be a little bit weird, and you'll be fatigued, you'll be tired all the time, and you'll be wondering why. These are all signs of liver stress. They're anecdotal signs that you'll notice when you have liver stress. And the eyes are a big one. You'll see a lot of guys who are using a lot of orals, or using a lot of orals for too long. Usually that's the problem, like, because orals are really fun to use. So, and they're really potent. And so it's like, and they have really good effects too, and they're cheap. So, there's a lot going for orals. And so people will be like, well, I want to take gear and I just want to be on orals all the time. So they're pretty much on orals all the time. They'll take some breaks here and there, but a lot of the times they're on orals. And what you'll notice with these people is their eyes will be a little weird. Normally they won't have like a nice crystal clear white of the eye, or the part of the eye that is pink, that is like near their nose, that inner part of the eye that is not white, but it's pink near the nose. It will be like red and inflamed looking. So that and then like bloodshot eyes or like really veiny eyes or gray kind of eyes, yellow eyes on the whites, just the whites being screwed up. That's what you'll see a lot of times with people who have chronic liver stress from steroids. So, even at high doses of injectables too, they can cause liver irritation. Like, if you have like some like your liver is like really under a lot of strain and you've been taking orals and your liver is not happy at all with you, it's probably not going to get all the way better unless you actually do a full cruise where you're on 200 milligrams of testosterone or less per week. It's the more any hormones get processed by the liver. It doesn't, but some are toxic and then others are not. But like also workouts are like really stressful on the liver. Workouts deliver a huge stress to your liver. And so it really like, cruising, like taking a week off of the gym, 2 weeks off of the gym, going on a legit cruise or just stopping everything for a month and then starting back up. If you're trying to get your liver back to like normal, and that's definitely the quickest way to do it. You have to remove the offending agent. Like stuff, when you remove the offending agent, using stuff like milk thistle, N-acetylcysteine, TUDCA, L-glutathione injections, that will help you. That will help the liver to heal quicker. But those kind of things don't heal the liver. So you can't just keep the offending agents in and then start taking those things and have the liver go back to normal. The only thing those will do is that when you're taking the offending agents, like oral steroids, for example, if you're taking those like liver supplements or liver aids, they will delay how long it takes for your liver to start having dysfunction, extreme stress, etc. All right, so let's look at another question. Let me bring up the chat. Somebody talks about the heart damaging effects of DECA and how to prevent it. Electronic raisin. That's a pretty cool name. So with the heart, that's the main thing, with anabolics that you got to watch out for. People, it's important to be looking at your blood work, and blood work can tell a lot of things about, the status of a person's health. But, have you ever heard of a bodybuilder dying of liver failure? I mean, that's like unheard of. But have you heard of a bodybuilder dying from a heart attack at a young age? Have you heard of a bodybuilder dying from a stroke at a young age? Yeah, absolutely. That's what kills all of them. So really what you're looking at with bodybuilding, as far as from what is the thing that from a dangerous health perspective, what are you looking at? Is you're looking at heart damage, heart effects. This is the main risk factor of steroids and getting hurt from using them. So, blood pressure is one. If you maintain chronic high blood pressure, you're going to damage your cardiovascular system and you're going to damage your heart. Another thing would be, having high LDL cholesterol levels, but that's debatable. There's a lot of debate on cholesterol, and, because what happens is, cholesterol, LDL cholesterol specifically, can form plaques when there's inflammation in the veins. And there'll be inflammation in the veins, and then the LDL cholesterol will come along and it'll kind of attach to the inflamed spot in the veins, and then there will be plaques formed that then narrow the veins, narrow the arteries, etc., the circulatory tissue. But, what caused the inflammation in the first place that then allowed the LDL to attach there, Or was it just having high LDL cholesterol levels? So, the cholesterol thing is not something that's 100%, just known, like this is the way it is, with cholesterol. So, there are some markers of internal inflammation, vein inflammation, artery inflammation, heart inflammation. So the main one that you want to look at is the C-reactive protein level, the CRP on the blood test. If you have an elevated CRP on the blood test, you want to get that down because that is going to result in plaques, because if you have that inflammation in your veins and your arteries, and then combine that with a bad cholesterol, a high LDL cholesterol, then you are 100% for sure going to be accumulating plaques in your circulatory system. So that's something, plaques in the circulatory system are something that, it's a plague to bodybuilders. It's a plague. That's one of the main things, atherosclerosis, circulatory disease, cardiovascular disease, heart disease. This is something that really affects bodybuilders. So, what are some things that cause high CRP? Well, your diet, if you have a high inflammation diet, that can be definitely a contributing factor. Eating a lot of carbohydrates, having high insulin levels causes a very inflammatory state in the body. And then, eating very low carbohydrates is the opposite. It causes a very low inflammation state in the body. So there's one thing. Another thing would be using synthetic oils, using, non-natural oils that are injected, as the carrier oils for the steroids. So like miglyol, ethyl oleate, other artificial oils that are being used to suspend the gear, not stuff like, the good oils that are good to use is stuff like castor oil, peachtree oil, cottonseed oil, grapeseed oil, any kind of natural and very high quality oil, not something that was bought, at the grocery store and then had benzyl alcohol added to it for a sterilant. So, the quality of the gear really matters. And these are things that, separate separate a UGL from a pharmaceutical grade product, is the quality of the inactive ingredients, how high quality they are. And that's going to have a major effect on your health long term, if this is something you're using long term, which most people are who use this stuff. So that's, some mitigating factors or some just things to look at, with your heart health. And, so then you have to look at, what is the state of, the plaque in my circulatory system. And how you get that checked is you get a cardiac calcium scoring test, or you get another name for it is called a heart view scan. Heart view scan or cardiac calcium scoring test. It's like an MRI on your heart. You don't need a prescription for this. You can just call up the hospital, and the first hospital might not be able to do it for you, but if you call up a few, they'll be able to do it for you. And even in America, you can do this without a prescription, and it'll be less than $100 to get this test done. But it's in like a one of those machines that is like a CAT scan, CT scan type machine. It's one of those white donut things that they kind of slide your body inside of. And then they take cross-section images of your heart and your coronary artery, the main artery with your heart. And they look for calcium plaque deposits there, and they're able to tell you how much calcium plaque deposits there is, and give you a score on this test that tells you like how advanced you are in progression of like cardiovascular disease, plaque in your circulatory system. What is the state of your heart? So if you're looking for like mitigating factors, and knowing like when to stop, when to calm it down, when can you feel more comfortable blasting, having a cardiac calcium scoring test done would be something that would be very beneficial. You're talking about reducing heart risk factors, reducing risk factors of heart damage, reducing the risk factor of dying young from a heart attack, from a stroke. Well, even more important, in my opinion, than looking at blood work to do that would be to have imaging done on your heart, like this cardiac calcium scoring test, so you can see what kind of state your heart's in. What's the main thing that's killing bodybuilders? Heart stuff. So that's good that you're looking at your blood work and everything. You're making sure your system's overall healthy. You're checking out markers, different markers that could signal that if something's not good or not. But the only way that you're really going to know about your status with the main killer, the main danger of bodybuilders, the heart, is you got to get imaging on your heart done. So then the other test that you can get done is the echocardiogram. And the echocardiogram is when they take an ultrasound of your heart. And they can do this with you running on a treadmill. That's called a stress test echocardiogram, and that's the most comprehensive, that's the most extreme. And this requires a prescription from a cardiologist. So this is harder to get. But it's really interesting and really cool, beneficial. So what they do is they look at all the chambers and the valves, the flaps inside of your heart, and you can actually see it. I've had it done, and you can see your heart in real time, live on the screen, inside your heart. You can see all the little freaking valves and flaps moving, the chambers squeezing. You can see how thick it is, how thick the chambers are. You can see if you have cardiomegaly. You can see if you have left ventricular hypertrophy. You can see if there's any kind of regurgitation, any kind of malfunctioning with any of the flaps, the valves, any of the chambers. And then a cardiologist looks it over and really looks inside your heart at everything that's going on in there and tells you, what's the state of your heart, how's the function. And so if you have damaged structures of your heart, or some kind of defects or something, some kind of something you were born with maybe that makes you more susceptible, or something you've damaged over time from using steroids, like such as cardiomegaly or left ventricular hypertrophy, this will be instantly apparent when you take the echocardiogram or the echocardiogram stress test. So when you ask, how do I protect my heart when, I'm doing bodybuilding? Well, you should get those tests done. A cardiac calcium scoring test and an echocardiogram test. And this should be something you get every couple years, every few years or something like that, so you can see what's happening. See if you need to pull the plug. See if you feel like you're good to continue going. And then that pretty much says it. That pretty much says it. There's also some agents that can reduce calcium depositing in the body. One's called famotidine. I take it. I take 20 milligrams of that per day. It's a chelating agent, calcium chelating agent. Helps prevent plaque from being laid down in your body. So that's what I have to say on that. Let's get to the next question. All right. Have you ever been in Bulgaria I have not, but I'd be interested to go to Bulgaria. Um, I'd also be interested to go to India. Um, okay, so Greg asks, I know your favorite dose of metformin is 2,000 milligrams. However, is that necessary for someone doing 2 to 4 IU of growth hormone per day, or is 500 to 1,000 at evening sufficient? Well, you're going to notice much more powerful muscle effects from the higher dosage. The lower dosage, 500 to 1,000 milligrams per day, is more of like insulin sensitivity, like as far as like not having your blood sugar levels go very high, and then also as far as like it's good for like fat loss. It's good for fat loss, keeps insulin levels down because insulin is the storage hormone. So when insulin levels are really high, it's basically impossible to burn fat, and it totally negates the process of lipolysis chemically. It neutralizes it when insulin is high. Um, so metformin makes you produce less levels of insulin, and these lower levels of metformin are pretty good at that. Decreasing the amount of insulin that you're producing. But the higher levels, 2,000 milligrams of metformin has very powerful effects in your muscles when it's combined with growth hormone like you're using. So because it makes you do more with the insulin that you have. So it makes you really damn sensitive to insulin. And so now your natural insulin becomes more like a performance enhancing drug because you're so sensitive to it. And what you'll get is like more spider veins on your muscles, freaky spider looking veins, very small, squiggly veins, very extremely full muscles. The way that you used to look when you were pumped in the gym, now you look like that just walking around without a pump because your muscles are so pumped up with glycogen pressing up against the skin, and more potent fat loss too with the higher dosage. So the higher dose of metformin, if you're not using growth hormone, if you're using steroids only, I think metformin's benefits pretty much tap out at about 1,000 milligrams per day. But if you add HGH, you go up to 2,000 milligrams, and man, that shit, the combination of HGH plus 2,000 milligrams of metformin produces some really incredible effects. Like, especially if you're a guy that doesn't want to take insulin, which I don't think it's good to take insulin, you guys. I don't think that's good. I think you're really playing with fire there. So, but if you want to have like an insulin light effect, insulin like effects, or an insulin light version, the closest you're going to get to that and getting effects, that could be like, yeah, it's kind of like using a little bit of insulin or something. And the main effect of that is muscle fullness, muscles bursting against the skin, more extreme veins, is going to be, using a higher dosage metformin. And the beneficial effects of metformin tap out around 2,000 milligrams per day. So, I mean, if I would take, 4 units of genotropin pen, norditropin pen, and I wasn't using metformin, if I went and added in 2,000 milligrams of metformin per day, it would be a night and day difference, motherfucker, in the way my body looked. All of a sudden, I would go from being like big looking to like very freaky and detailed looking. And it would be in a matter of days, 5 to 7 days. So, I know they talk a lot of shit about metformin on the internet, but a lot of guys that talk shit about it are secretly using it, okay? And then another thing is that a lot of motherfuckers are using insulin, very unwise. Why do you have to go there? Why do you have to go there? Going to insulin use. Well, they say because it makes me so much bigger. It just makes me so much bigger. There's nothing like it. That's what they say. And you really have to ask yourself at that point, how bad is your muscle dysmorphia, motherfucker? Because once you introduce that insulin, it's doing very powerful things in your body. In addition to the weight gain, in addition to the acquired diabetes risk, when we're talking about inflammation in the veins, inflammatory factors, an inflammatory internal body state, IGF-1 levels that are just way too high, organs growing, cardiomegaly, stuff like that. Taking and then having extreme plaque, stuff like that, because of inflammation, and then the inflammation gives way to having the LDL cholesterol attached to those inflamed areas. We're talking like really upping the risk, man. When you add the insulin in there, you're really upping the risk of what you're doing. So, I don't think, I think people should ask themselves, like, yeah, is it effective for getting big? Fuck yeah, it's effective for getting big. But it's like, how much do you really have to do, man? Like, why do you have to go there? Because you can build 100 pounds of muscle with just steroids and growth hormone and everything. And like, do you really have to go to this area where it's like no one other than other bodybuilders thinks you look good, man? Like, your muscle dysmorphia is so out of fucking control that like, no one wants to look like you except for other people who are into bodybuilding. You've gone past the realm of what a normal person wants at all. That's the look of what insulin produces. So, I mean, yeah, if you want to win competitions, etc., you may have to do certain things, which is sucky. And, the judging for that should change so that that's not necessary, because that's shitty. It's not even a good look. Once there's too much hyperplasia on the muscles anyways, they just start looking like styrofoam. Because once those muscle cells start splitting too much, and they, you get too many new muscle fibers, you see this look on people. The muscle just loses its integrity. Where one muscle starts and the stops and the next muscle starts, it all kind of just blends together, and you become this big block. And the muscles have this kind of styrofoam, hollow look to them. It's not dense, granular, grainy. It's more styrofoam, puffed up, weird. And it's a progressive thing too. Like, the longer you're using it, the worse it gets. The more you abuse it, the worse it gets, So guys are going to start using that shit, and they're going to be thinking, oh, this is the greatest, I got so much bigger. And they're going to get all into it. And then, down the road, they're going to have consequences, and they're going to be like, what the fuck happened? Like, my body's fucked up. My organs are 2 or 3 times the size they're supposed to be. Too late, buddy. You made a bad choice, man. So that's what I think about that. That's what I think about that. And you don't get any of those problems if you use metformin, and which can give you a light version of those effects. You can use growth hormone, metformin. You can use steroids. You can build a shitload of muscle, man. And, you can place well in classic physique competitions, etc., And you can do all that without using insulin. You can look fucking phenomenal. You can look too big for the normal person, where the normal person isn't going to want to look anything like you without having ever touched insulin. So that's my, that's what I think about it. That's what I think about it. Let's get to another question. The Real Scott says, do you still think you need to take a gram of test to get massive? Well, hold on one second. I got to get a drink. All right. So most everybody that has tried out 500 milligrams of testosterone per week for their first cycle, not super impressed by what it did for them. That's what they're going to tell you is, yeah, I noticed a boost. I got bigger, but they're not raving about it. They're not being like, man, I know what it's like to be on steroids now. Steroids are awesome. You don't really hear that about 500 milligrams of testosterone per week. So then you get people like adding other compounds in. And then, you'll start hearing like, yeah, it was good, So maybe he added in 200 or 300 milligrams of tren, or he added in 50 milligrams per day of Winstrol or Anadrol, 100 milligrams of Anadrol, 30 milligrams of D-ball, 50 milligrams of D-ball. I don't know. But now you are getting up into the gram per week range. Or, in the case of some of these really heavy hitters like D-ball or like tren, you can multiply the strength of whatever milligrams of tren you took by 5 to get the effect of testosterone. So if you're, roughly 300 milligrams of tren is about as strong as like 1,500 milligrams of testosterone. So, if a guy's saying like, oh yeah, I took 500 tests, 300 tren, well, you're on the equivalent of about 2,000 milligrams of testosterone, buddy. So if you think you're all like mild or something, and then, you're like, blowing a gasket when someone takes a natural non-toxic hormone like testosterone, that is the safest hormone for you to take, with the least, health issues with it. And you're going, you're insane. You took 2,000 milligrams of testosterone? You're insane. Well, look, buddy, you were just taking 300 milligrams of tren, which is about 1,500 milligrams of testosterone, and what it does, and it definitely has very toxic effects, definitely is cardiotoxic, definitely has effects, and people say, oh, my blood work, fuck your blood work, man. There's more stuff going on than your fucking blood work, okay? And so they have that, they got their 1,500 milligram equivalent strength there, and then they're taking 500 milligrams of test in that, and then they're blown, so they think they're all cool, with their 800 milligrams of roids per week, but 300 was tren, so it's really like, they were taking 2,000 milligrams per week. And then somebody blows a gasket when somebody, is taking 2,000 milligrams. That's like, oh my God, it's unheard of to be taking that much testosterone per week. What the fuck? You're so backwards. You're just spouting the orthodox shit, It's just something new. And so in your little echo chamber that you have of what you're used to hearing on the internet, and what you're used to hearing pro bodybuilders repeat to you, and what you're used to hearing in the gym, all of a sudden your little echo chamber got disrupted. Your little echo chamber got disrupted. Your little echo chamber got disrupted, bitch. And now you're like freaking out. You're all acting like some, some hen. You're acting like a hen, and you're gossiping, you're hooping and hollering about these gram of testosterone or 2 gram of testosterone, 1.5 gram of testosterone. You're insane, man. You're insane, man. Fuck you. You've been taking all this trend and all this other shit. Now just because somebody takes a high dose of the hormone that is the most healthy hormone, and they're taking, it fucking works, by the way. It's the least risky hormone for you to take for your health, okay? And just because it's different than what you've heard, and your little echo chamber of what you've heard on the internet of what you should do got disrupted. Now you blow a gasket and you think people are going insane or something like that. Man, you don't know fucking shit. You don't know shit. You don't know how this stuff works. You don't know how this shit works, all right? You are just somebody who reads things. You're part of the masses. You're part of the masses, and you repeat. You repeat things. You read things, you hear things, you consume the mainstream opinions, and you repeat them to motherfuckers. And man, you gotta think outside the box, all right? Maybe you should okay, not maybe you shouldn't, okay? I'm not gonna advise this, okay? Maybe you should do something psychedelic. Okay, maybe so you can open up your mind a little bit, okay? Or you know what? If you want to do a natural psychedelic way, yeah, you should just stop eating for 48 hours or 72 hours, okay? Because that makes you get a little psychedelic too, Makes you start having crazy thoughts. Think outside the box. Think about some kind of sentimental, some kind of weird, some kind of shit. Because yeah, so fasting is like a natural way to have like psychedelic experiences. It fucking is. That's why religions do it, But that's beside the point. I'm kind of joking, about like maybe you should have a psychedelic experience or something like that, But I'm just trying to say that you guys that are just so opposed to testosterone, like, man, you guys have got some kind of like mental deficiencies. Like, fucking hell. Shit. Like it's this groupthink thing, You're caught up in groupthink, and you're not willing to research things. You're not willing to go and see for yourself, what are the effects of these things. Test it out yourself. You're just too afraid to move out of the mainstream of what everyone else is doing. You're just too afraid, man. So you're stuck. You're stuck. You're stuck in your little echo box, your little echo chamber. All right. Let's move on to another question. All right. Oreo Gorilla says large cycles. Is it better to be running multiple compounds at smaller doses, or only one or two at larger doses? And so this is a good follow-up to the previous question. Okay, is that testosterone is going to be the one that causes you the least problems with your health, like long-term problems, okay? And so keep that in mind. There are other hormones, though, that are very good muscle builders. And, taking different types of hormones works good. Taking smaller doses of a lot of different types of hormones rather than really huge dosages of one or two hormones. The lot of different types of hormones at lower dosages, that add up to a high total dosage is going to be more effective than only one or two hormones at super high or at high equal dosages, because you get different metabolic pathways for the anabolic process, metabolizing food, protein retention, etc., that are happening with multiple hormones being used like that. So, it's going to be more effective from a pure bodybuilding standpoint to use a plethora of hormones rather than just one or two hormones. As far as like safety, and we're talking about building muscle size here too, because getting really big, using higher dosages of hormones is like very, very effective for that. And it's not going to do it alone, though. It's not going to do it alone. Certainly is not going to do it alone. If like we said in a previous podcast, it's a very delicate balance. You have to have all three going at the same time, training, diet, and gear all at the same time, or else the whole thing is fucked. And, you can take as much fucking gear as you want, and that's not going to make you big if your training and diet isn't in the right place. So, there are going to be guys who are taking enormous amounts of gear who are not the size that they should be, so that's what I'm saying before I talk, and say things like, you know, taking a lot of gear, taking higher dosages of gear is very effective in building muscle mass. It's effective, provided, the other two components are correct, but if they're not correct, then it's not effective. Um, so, uh, DECA, equipoise, primobolan, those are the hormones that are the next least toxic over the long term and are going to have the least effects of damaging a person's health over the long term used at, significant dosages. After testosterone. Testosterone is the healthiest one with the least long-term likelihood of long-term harm. And then after that, it's in no particular order: DECA, primobolan, and equipoise. And so you want to be, thinking about those three hormones and testosterone as far as, the most sustainable possible way of, doing what's necessary and, really pursuing bodybuilding if that's what you're doing and getting really big. You want to really be utilizing those ones. And then you got other stuff too, that works really good. Like you've got growth hormone. Growth hormone makes everything work way better, makes all your steroids work way better. You can get so much bigger on growth hormone than you can get not on growth hormone. And then you have other ones too, like, but these are ones you want to use more sparingly, so there's stuff like anadrol, there's stuff like D-bol, there's stuff like trenbolone, there's stuff like Superdrol, Winstrol. Anavar is pretty good too, and probably out of all the orals, Anavar is probably the least toxic one to use, significant amounts of, or, if you were going to use in orals a lot and you had to choose one that was, like a lower toxicity, but it's definitely not lower toxicity on a scale of like, compared to DECA, primobolan, and equipoise, so Anavar is in the next tier over, that oral tier, so Anadrol, D-bol, Superdrol, Tren, and if in that tier you were talking about which one is the least risky, you'd put, over the long term, then that's where you're putting Anavar. And someone was asking too, what are the best PEDs for women? So I appreciate that question, and I appreciate the female listeners to the podcast. I definitely want to help you guys. So, I'll just tell you right now what most women use, and just mention too that a lot of women are taking steroids, and a lot of women that you don't know are taking steroids, and a lot of them are injecting steroids. So NPP is very popular for female steroid users. Nandrolone phenylpropionate, fast-acting nandrolone injection, primobolan injection is also popular. So is equipoise. All three of those anabolics are definitely popular. Anavar is definitely the most popular. And Winstrol is pretty popular too. pre-contest, it's pretty common for women to use Proviron, Nolvadex too, and even like Letrozole. They'll use Letrozole pre-contest. So now we're kind of getting more into competitive female competitions. We're looking more at diuretics. We're looking more at stronger androgen, like stronger male hormonal stimulation, like Proviron. Looking at anti-estrogens, Nolvadex, Letrozole. These are commonly utilized. Probably the two most commonly utilized pre-contest diuretics are Diazide and furosemide, Lasix. You got to know, with using diuretics, you got to know what they're doing. Okay, so because they're messing with your electrolytes. So if you are messing with your electrolytes, which is how your heart beats, runs on electrolytes, you got to know, how to fix that if something goes wrong. Okay, so don't just start popping diuretics and thinking you're going to be okay, because if you don't know, like, the antidote to your diuretics, you could run into problems. So be careful with that. So we're kind of talking about, hormones, male hormones that females use, but, clenbuterol is the best thing for women to use with, like, the lowest side effects, the lowest long-term problems. Clenbuterol and HGH, those are the two best PEDs for women to use. And then Melanotan 2 as well. Melanotan 2, a lot of women, they're trying to lose weight. So Melanotan 2 is going to take your appetite away. So it's going to freaking take your appetite away. You're not going to eat. If you're taking Melanotan 2, you're not going to be able to eat, and you're not going to want to eat. So very effective for somebody who, is somebody who has problems sticking to their diet, but usually if you have problems sticking to your diet, it's because you're addicted to carbohydrates. Very emotional subject. If I ever talk about carbohydrates, you guys get so upset. I know I'm talking about your drugs, and you're not going without your carbohydrates. I know, you're addicted to the modern diet and you have dysfunctional fat cells. And so, when your body runs out of glucose, your fat cells are not able to effectively start releasing fatty acids into the bloodstream to take over as the energy source. So even though you've got a bunch of fat tissue on your body, as soon as your glucose from your food runs out, you're in a state of internal starvation because those fat cells are just not releasing their fatty acids and you're not able to metabolize them. So until you heal yourself metabolically, doing what's necessary for that, which we can talk about at another time, you are going to be totally, hopelessly addicted to carbohydrates. And what do carbohydrates do? They spike insulin levels. What does insulin do? It has a direct effect on shutting off lipolysis, shutting off fat burning. If insulin goes up, fat burning is off, motherfucker. It is off. So, a low-calorie diet is another way of lowering insulin levels, you guys. It's just another way of getting insulin levels lower, and so weight loss happens. We could really get into all that. We could really get into all that. And the other thing is that, when insulin gets released, what is the action of insulin? Well, it's to get rid of sugar or glucose from your bloodstream and put it in the cells. So what happens when insulin gets released? You feel fucking hungry because now all of a sudden there's no more energy in your bloodstream. So then what do you want to do? You want to eat more? So, if you can't stick to a diet, it's because you're eating too many carbohydrates. Your fat cells are damaged from eating too many carbohydrates, and you have a massive addiction to sugar that you have to destroy. Sugar, glucose, carbohydrates, all the same word. So that's what's going on there, and that's how to help people. Because we were talking again about like a drug to overcome a problem. But it's a naturally solvable problem. If somebody has problems sticking to a diet, it's because they have carbohydrate addiction, and metabolic damage. So that's what's going on there. And rather than turning to a drug, which is going to be a temporary solution that's then going to rebound, and the problem's going to come back. After they stop taking it, they're going to have their appetite back again, or they're going to be addicted to or dependent on this drug then, in order to destroy their appetite problems. It's much better to take care of the problems at the source, rather than using drugs to cover up your deficiencies. All right, guys, so that's the end of the podcast today. I hope you guys enjoyed this episode of the Bodybuilding Podcast. I am working on the second book, Ultimate Guide to Roids 2. Don't Keel Over Dead. It's more than 2/3 done, and I'm looking forward to bringing that out for you guys. If you want, the best information on all the PEDs, how to, the information you're looking for all over the internet, all in one place. The first book, Ultimate Guide to Roids by Dan the Bodybuilder from Thailand. There's a link to it, in the description for this, or, you can go to bodybuilderinthailand.com, and it's the first article on the home page. You can go read like 10 or 15 pages from the book there. Very protected information, practical information, real information, information that is what everybody's looking for, and it's being hidden from you on the internet, As you know from listening to the podcast, that's not what I'm like. I'm going to give it to you straight. I'm going to treat you like an adult. I'm not going to treat you like a child. I'm going to give you the information and let you decide what to do with it. So that's what's in there in Ultimate Guide to Roids. Ultimate Guide to Roids 1, that's available now. You can click on the link to it. It should be in the description wherever you're listening to this or watching this podcast. Or, you can go to bodybuilderinthailand.com. And, it's the first article on the homepage. You can go read, a lot of sample pages. Excellent, valuable information for it. Book's very cheap too. I made it the price, to make it affordable to everybody, even in third world countries. It's, less than half the cost of what a freaking average vial of steroids costs someone, so could save you a lot of money, a lot of heartache, reading Ultimate Guide to Roids by Dan the Bodybuilder from Thailand. And then other than that, if you guys want to get on the phone with me, I do the phone call consults, and the 1 month daily text messaging for bodybuilding coaching on WhatsApp. So, if you want to do one of those and you want to get in contact with me, just send me an email, steroidspodcast@gmail.com, and I'll get back to you and we can set something up. All right. So it's good talking to you guys today.